Inpatient distribution refers to the drug distribution that in the patient department, it can be carried out from the outpatient dispensing area. Okay? So the drug distribution in the inpatient distribution or in the inpatient department, pwede siya kunin doon sa outpatient dispensing area. So walang exclusivity. Kung baga, pwede mo lang makuha yung mga drugs in case na wala na sa basket for inpatient doon sa outpatient dispensing area. Okay, so the pharmacist is involved in dispensing the drugs for for outpatients too. Okay, so aside sa inpatient, si pharmacist din is responsible for the outpatient. So basically, yung mga drugs na for inpatient, tapos naubos, pwede lang tayo magkuha kay outpatient. And si pharmacist ang responsible for that. Both sa inpatient and outpatient. Okay, so yung inpatient distribution refers sa yung distribution ng drugs from the storage area to the hospital bedside to the patient that is admitted. Okay? That is admitted in the hospital. Okay? So meaning naka-dextrose yan kapag inpatient. Okay, so I think it's understandable naman. Okay, so the pharmacist employed for drug distribution to the inpatient wards should be well-skilled and qualified staff. Okay, kasi you are going to meet the patients directly. You are going to see them. Tapos you distribute drugs, okay, doon sa bedside nila. So, that is why meron ka talaga dapat communication skills, dapat placing and personality mo. You dapat well-skilled ka and also at the same time qualified ka to be in that position. How about for the outpatient distribution? So, outpatient, when you say outpatient, it refers to the patients not occupying beds in the hospital. So, basically, hindi to siya admitted sa loob ng hospital. It actually part siya doon ng OPD. I think you're familiar with that. OPD means outpatient department. Okay, so basically, again, outpatient refers to the patient not occupying beds in hospital or in clinics, health centers, and other places where outpatients usually go for healthcare. Okay, so no medicament should be issued without prescription. Kapag outpatient class, wala dapat medicaments na ma-issue without prescription. Lahat with prescription yan. Kasi galing ka doon sa clinic nila. So, kahit over the counter pa yan, basically, reresetahan ka pa rin ni doktor. Bibigyan ka pa rin niya ng reseta, which is doon mo kukunin sa butika. Or pwede din outside, you have the freedom naman. Okay? But the pharmacy inside the hospital, hindi mag-a-accept if walang reseta. Okay? So, after the issue has been made, the quantity supplied must be recorded. Okay? So, after na-issue yung prescription sa patient and then the patient goes to you, after that, i-record mo yan. Okay? Kasi part yan ng inventory. Okay, so in short form, the outpatient department is called OPD. Okay, so we have 5 types of drug distribution system. Okay, 5 types. Yung dalawa kanina, that's the categories. This one is the 5 types. Okay, we have individual prescription order system. We have complete floor stock system. We have combination of individual prescription and floor stock system. We have unit dose system and we have non-floor stock system. Okay? So, we are, sandali lang class ha. Wait lang talaga. Maingay. Okay, so yun, natahimik na. Okay, so can you still see my screen?
Yes.
Okay, so for this session, we are going to include lang dalawa. The individual prescription order system and the complete floor stock system. The rest will be covered sa next Friday na. Okay? Individual prescription order. Individual prescription order is a type of outside ng hospital, outside hospital or for to any medical store or sa within the vicinity. Okay, hindi siya kasi nga labi na outpatient, di ma-charge kasi admitted man. Sorry, hindi man admitted record for admission. So, dili siya pwede ma-charge tapos after lang ang pag-out OPD bayad dyan na diretso. Okay, in case ha nga OPD, naka-OPD si patient. Okay? So again, sa individual prescription order, it is a type of drug distribution system wherein the physician writes the prescription of individual patient who obtains the drugs prescribed from any medical store or pwede din sa loob lang ng hospital dispensary by paying their own charges. Okay? This system class is generally used by yung mga small or private hospitals because of the reduced manpower requirements. And also, the desirability of individualized na service. Okay, kasi individual ang pagreseta ni doc. So, individualized din yung service. Okay? For the advantages, all medication orders are directly reviewed by pharmacists. Okay? So, lahat ng medication orders, they are directly reviewed by the pharmacist. That's the advantage. It provides the interaction of pharmacist, doctor, nurse, and also the patient. Okay? And it provides clear inventory control. Okay? So, kasi nga individualized siya, so mas madali mo siya i-monitor yung inventory. Kasi you will record it according to the patient. So nakalagay naman doon ang quantity. Okay? So aside from that, it provides interaction to pharmacist, doctor, nurse, and the patient. And mas matutukan nila patient per patient. Yung team of yung healthcare team mas makafocus sila by individual patient. Okay? This is actually one of the core ng advantages ng individual prescription order kasi you can have interaction. Okay, pwede ka na makabuild ka ng relationship, harmonious relationship with the other healthcare members of the healthcare team. How about for the disadvantages? Pinaka-common na disadvantages. We all know that the most of our physicians kuan jud ang agi kanang murag kinahig sa manok o sa Bisaya pa murag kinahig sa manok. Okay, so most of them have eligible writings. That is why because you are a future pharmacist and you are a pharmacist, that is not taught in the klasa in the school. But because you are a pharmacist, you are very familiar, memorize man nimo ang tanang drugs, that is why you are capable in reading. Kasi kaya ka mag-decode kasi alam mo naman yung mga drugs. So if it ends with sartan, tapos it's ang nabasa nimo it ends with sartan, so it can be losartan. So paano mo malaman na losartan? You look at the dosage. Losartan is 50 and 50 and 100 milligram. So if 50 and 100 most of the time losartan talaga yun siya. And then you ask the patient na unsa day ka ma'am, is this a maintenance drug? Okay? Kasi if it's other sartan, halimbawa olmesartan, so it can be 80, 160 or 320 milligram. So, pero 50 milligram man, so imposible to mag-olmesartan kung 50 milligram ang nasa prescription. Okay, so again, if you're knowledgeable enough, you have a vast knowledge for drugs, dali lang na ninyo basahon ang reseta. And experience is the key. Okay? Habang nagakadugay mo in decoding the prescription, mas nagiging mahusay sa pag-decode ng reseta. Okay, so that's one of the disadvantages. Wrong errors and eligible writing of the physician that will lead to wrong dispensing. Okay? So, physician may write a high economic drugs in the prescription or cost-effective drugs. Okay? So, one of the disadvantages na ay freedom si physician magsulat sa iyahang sa iyahang drugs. So, most of the time, basig ang gusto ni Doc katong mahal ba? Or what if dili available sa market? Sa hospital mismo. What if tong dispense ni doc is high economic, so meaning taas ang demand, so most of the time siguro mawad-an og stock, so dili ni mamahatagan si patient. The tendency is mogawa si patient adto siya sa laing drugstore. Okay, so in ana, so the physician has the sole responsibility for the choosing the drugs. Okay, that's for the individual prescription order. Let's proceed with the floor stock system. Okay, so the floor stock system, these are the drugs that are given to the patient from the nursing station and the pharmacy supplies from the drugstore. Okay, again, drugs that are given to the patient from the nursing station and also from the pharmacy supplies from the drugstore. Okay, so the way of floor stock distribution class includes two types. We have the charged floor stock system and the uncharged floor stock system. What is the charged floor stock system? The charged floor stock sa method ng charged floor stock system, uh, yung stocks ay na-i-stock. Okay? Yung drugs are stocked in the nursing stations. Okay? So, the medicines are stocked in the nursing stations all the time. Okay? And it is charged to the patient's account after it is administered to them. Okay? So, basically, yung charge floor stock system is exclusivity to siya sa mga inpatient. Okay? Sa mga inpatient. So, basically, lahat ng drugs doon sa nursing station, nakastock. Tapos, kapag i-administer yun ni nurse, automatic yung naka-charge sa account ni patient, which will be paid after the patient has discharged. Mag-appear lang na siya dito sa bill. Okay? The patient is charged, it is charged to the account after it is administered to him. Okay, so charged to the patient's account after it is administered yan class. Okay, wala na nang tuda nun sa man ay. So, charged to the patient's account after it is administered to him. Okay, to him. Okay, so once the floor stock list is prepared, it is the responsibility of the hospital pharmacist to make the drugs available. Okay, kasi the nurses are the one who administers sa charge floor stock system kasi andun sa ano nila, sa drugs nila. Sa station nila. So, mahirap yun i-monitor. So, ikaw as pharmacist, dapat responsible ka kasi hindi naman ikaw ang nag-administer. Si nurse naman. What you do is you make sure na the drugs that are needed in the hospital, in the station, is being provided. Okay? So, dapat available yan sila. You make sure that the drugs are being made available to the nurse station. And also, of course, you need to monitor those stocks. You inventory them from time to time. Okay? Kasi, if ever may mga losses dyan, the liable will be ikaw at saka yung nurse. Okay? The pharmacist and the nurse. So, this is an example of. Okay? So, again mo ni ang label. So, we have the hospital name below, the Vignan Hospital Pharmacy. So, anong patient ward siya? So, halimbawa, sa San Pedro Hospital, Davao City, yan siya. Yung ward nila is naka-name sa Saints. So, halimbawa, Saint Matthew. Okay, the patient ward is Saint Matthew. Okay, and then under that, you have the drug and its dosage form. So, we have phenobarbital tablets, the name of the drug, and then the dosage form. And then, ano yung content niya. So, each tablet contains 50 milligrams of phenobarbital kasi that's phenobarbital eh. That's the brand of phenobarbital. Phenobarbital. Okay, so phenobarbital dose of 50 grams. Okay? So, ang laki naman ng 50 grams. I think this is 50 milligrams class. Ang laki ng 50 grams. 50 grams talaga? I'm still going to check that one, ha. Kung 50 grams. 1 gram nga, ang laki na eh. Baka nagkabaliktad lang to, 50 milligrams. Okay. So, let's proceed with the non-charge floor stock system. Sorry. Non-charge floor stock system. This system includes the medicaments placed in the nursing station that are used by all the patients on the floor. Okay, so this again system includes the medicaments placed in the nursing station that are used by all the patients on the floor. Basically, parang charge lang siya. Pero, parang charge floor stock system lang siya, class. Pero, walang direct charge from the patient's account. Okay? Walang direct charge from the patient's account. So, this is divided into two methods. We have basket method, drug basket method, and mobile dispensary unit. Okay, basket method and mobile dispensary unit. Are you still there?
Yes, ma'am.
Okay. So the drug, thank you. The drug basket method, it's a method wherein the nurses fills a requisition form for the delivery of drugs at the floor. Okay, at their floor. Okay, so nurses fills a requisition form for the delivery of drugs at their floor. So when there is an empty container class, the nurses place it in the drug basket. Okay, so when there is again an empty container, the nurses place it in the drug basket. And once the basket is completed, delivery of drugs is done via messenger services. Okay? So, ano yung itsura ng drug basket method? Yun, ito siya, class. Okay, ganyan siya. So, uh, the pharmacist feels that basket, okay? Kapag makita nila kapag nakita nila na meron ng empty container which the nurses place in the drug basket, they will refill it. Okay, they will refill it. But who will refill it? It's the nurses. Okay, it's the nurses. So once the basket is completed, again, the delivery of drugs is done via messenger services. And then lastly, last for this meeting, we have mobile dispensary unit. Okay? For the mobile dispensary unit, gumagamit tayo ng, ano na to siya, class, parang automated na siya. Okay, parang meron na siyang scanner. Okay, so it is specially made up of stainless steel, and that it has it is mounted on bottom types. So for clear understanding, ganito yung mobile dispensary unit. So nadiri sa baba si drugs. Okay, nadiri sa baba si drugs, and then you will scan that. Scanin mo siya and then na-add sa system. Okay, so automatic mas dali siya actually inventory. Okay, kasi scan ka na lang um for those gamot na i-dispense mo sa station, okay, or sa different patients. Ganun lang siya, class. Madali siya. Okay, so ang standard niya na height, class, for mobile dispensary machine or equipment, ang gamit niya, ang standard na height is 60 inches. Okay, 60 inches in height and 40 inches wide and 25 inches in deep. Okay, so that is the mobile dispensary unit. Do you have any questions? Okay, so this is ano na. Sorry, na-repeat na to siya eh. This is individual floor sacs. The next one na siya. Okay, so do you have questions? Questions so far? Do you have questions? Yes. Yes. Sa non siya, we have two types of non-charge floor stock system. We have drug basket method and mobile dispensary unit. Okay, do you have other questions? Wala na?
Wala
Okay,
na,
so
ma'am.
if none, sige. If none, let's see let's say you all on Friday. Okay, Friday morning at 8 a.m. Thank you, class.
Thank you, ma'am.
Have a good weekend.
Thank you, ma'am.